It's possible to be pregnant without even knowing it. In fact, some women give birth to babies all of a sudden, without knowing they were pregnant the entire time. This rare phenomenon is called cryptic pregnancy or denied pregnancy, and it's where a woman remains unaware of her pregnancy until late in gestation, or even until labor begins. During a cryptic pregnancy, a person may not experience typical pregnancy symptoms. The inability to detect pregnancy early on can be caused by diverse and complex physiological, psychological, and social factors. Hormonal imbalances, for example, can disrupt the typical signs and symptoms of pregnancy, such as nausea and amenorrhea, which is the absence of menstruation. Women with irregular menstrual cycles or those experiencing perimenopause may not perceive a missed period as unusual. Typically, a missed period is a key indicator of pregnancy, but there are various reasons why this might be misinterpreted. If you have recently given birth, it can take time for your periods to resume, and many believe that breastfeeding prevents ovulation, reducing the chances of becoming pregnant. Women with polycystic ovary syndrome often have irregular periods, making it easy to overlook a missed period. Some women in perimenopause or late 40s might mistake pregnancy symptoms for signs of menopause. On top of that, women who have never been pregnant before may not recognize the symptoms of pregnancy, and those with a history of infertility might believe they cannot conceive babies, hence they miss the signs of being pregnant. High stress levels can affect hormones, making pregnancy symptoms hard to detect. Apart from that, having an anterior placenta, where the placenta is in front of the uterus, can reduce the sensation of fetal movements, which might be mistaken for gas. Taking a pregnancy test too early can result in a false negative, leading to the belief that they are not pregnant. Psychological factors such as denial, stress, or a history of trauma can also contribute to a woman's subconscious unawareness of pregnancy-related signs. On a societal level, the stigma associated with unintended pregnancy or the fear of judgment can lead women to subconsciously disassociate from their bodies and deny the reality of their condition. Women experiencing this condition may notice subtle changes in their bodies, such as weight gain, fatigue, or abdominal bloating, but attribute them to other factors like dietary changes or stress. Pregnancy symptoms can differ significantly from person to person, and even for the same individual across multiple pregnancies. Weight gain, a typical pregnancy sign, may not be obvious due to the fetus's position or the individual's body type. In some cryptic pregnancies, the fetus may also experience slower growth, leading to underdevelopment. The lack of awareness can impact both the mother and the fetus, as it often prevents prenatal care and preparation for childbirth. To confirm a cryptic pregnancy, it is recommended to take multiple pregnancy tests and consult with a doctor for an ultrasound, blood test, and urine test. Cryptic pregnancies pose significant risks due to potential lack of prenatal care, which can adversely affect both mother and baby. If the mother engaged in smoking or alcohol consumption during the cryptic pregnancy, the fetus may have been harmed. Babies born from these pregnancies often have low birth weights and are smaller than expected for their gestational age. Cryptic pregnancies carry increased risks of premature birth and stillbirth. While rare, most cryptic pregnancies are discovered by the 20th week, with only a tiny fraction, roughly 1 in 2,500, going unnoticed until delivery.